Madam President, we are grateful to the Undersecretary General of the United Nations, Mr. Tom Fletcher, for the comprehensive assessments of the humanitarian situation in the Gaza Strip. We listened attentively to the statement delivered by the civil society representative, Madam Bushra Khalidi. What we have heard confirms the obvious. In the Gaza Strip, we are talking about a deteriorating humanitarian catastrophe. The ceasefire has resulted in a lessened intensivity of hostilities and has secured the release of hostages and some Palestinian detainees. However, the key humanitarian provisions of Security Council Resolution 2803, including the full resumption of assistance, humanitarian assistance, deliveries thereof, and distribution without intervention of the parties, protection of civilians, as well as creation of conditions for rebuilding basic infrastructure, is implemented in a piecemeal manner. The ceasefire has also not become a guarantee for the safety and security of civilians in Gaza. According to the Gazan Health Ministry, since the announcement of the ceasefire on 10 October 2025, 1,005 Palestinians have died. More than 3,000 have been wounded. From 3 to 10 June alone, there have been reports about 39 dead and 109 wounded Palestinians. There was a high-profile murder of a Palestinian doctor from the Jaffa hospital as a result of an airstrike targeting a police checkpoint near the Al-Manfaluti school in Deir al-Balach. An additional factor of instability is the continuous westward movement of the so-called Yellow Line, which is resulting in further displacement of families and which is jeopardizing civilians who are in the gray zone. The Israelis are openly talking about the intention to seize control of 70% of the Strip. Such actions are imperiling the further implementation of the Trump peace plan, demonstrating the futility of attempts to pin full responsibility for the deadlocked negotiations on the Palestinian side. We are alarmed about the plight of humanitarian and medical personnel. According to OCHA, in June, 7 Palestinian Red Crescent EMTs were detained. One of these individuals has still not been released. UNICEF has also announced the deaths of 2 water truck drivers who are working under contract with the Children's Fund for water collection operations. And there's adequate humanitarian access is not being provided for. According to OCHA, Kerem Shalom remains the sole operational entry point for approved cargo of the United Nations and humanitarian partners. The temporary closure of this point from 7 to 8 June revealed the extreme vulnerability of the entire humanitarian deliveries system. The commercial imports do not guarantee the receipt of vital goods and cannot replace humanitarian assistance under conditions when much of the population is deprived of their means for subsistence. Even after the resumption of the work of the operations of Kerem Shalom, the humanitarian convoys are encountering delays, congestion, as well as additional inspections. A separate problem are persistent limitations on the import of critically important goods under the pretext of their being dual use in nature. Banned items include, and these are key for survival. These banned items include those necessary for basic survival: medical equipment, tents, blankets, sleeping bags, diapers, crutches, and wheelchairs. Access to water and food is a daily problem for the residents of Gaza. According to OCHA, the main drinking water source for more than 70% of the population is water truck deliveries, which depend on fuel, security of roads, and financing. The food situation is also dire. Residents of Gaza, on average, are able to eat only 2 meals a day, and approximately 20% of these people only can eat 1 meal a day. And this means that the basic needs of people continue to be unmet, and this is an ongoing issue. And at the same time, we would note that ongoing the ongoing deliveries, that there are the difficulties in access. And in this context, the World Food Program has reported that in May, truck traffic to Palestine has increased, and this has resulted in a slowdown in growth of prices in local markets. The healthcare situation remains critical. Not a single fully operational hospital is left standing in Gaza. There are major obstructions, and they are persistent for medical evacuations, including for oncology patients, for children, for patients with severe trauma. And against this backdrop, the spread of disease due to overcrowding is an issue, as is the shortage of drinking water due to the devastation of the sanitation infrastructure, which generates risks of further worsening of the epidemiological situation. All of this is taking place amid an acute funding shortage for humanitarian response. The UN humanitarian appeal for Palestine of $4.1 billion is only 15% financed. In practice, this means that partners need to cut down even vitally necessary services. The main victims here are children. This environment, the environment which is necessary for children to have normal lives and to develop normally, has been devastated in Russia. We are not only talking about the well-being of children today. More than 637,000 school children have been stripped of access to education for the third consecutive year. More than 90% of schools have been destroyed or are not safe for occupancy. An entire population has been denied both their present and their future. The OCHA humanitarian situation report on Palestine and UNRWA reports are difficult to read. It is hard to imagine how Palestinians are managing to surmount their day-to-day tragedies which they endure, and there is a need for urgent action. Otherwise, the current trajectory will give rise to irrevocable consequences. We stress that delivery of humanitarian assistance must not be made contingent on the fulfillment of political demands. The delivery of humanitarian assistance is an obligation of the parties to the conflict under international humanitarian law. There's a need to provide for the immediate, full, safe, and unimpeded delivery of assistance to the Gaza Strip through all accessible roads and crossings. There's a need to lift the baseless restrictions on the import of critically important goods, including equipment for water delivery, sanitation, energy, and healthcare. There's a need to protect humanitarian and medical personnel and to cease the practice of forced displacements of population. Of particular significance is preservation of and full support for the work of UNRWA. UNRWA has for decades been the linchpin for humanitarian, educational, medical, and social support for Palestinian refugees. Attempts to expel the agency from Gaza or to replace it with temporary assistance delivery arrangements will merely exacerbate this chaos and will create additional threats to the entire region. We hope that member states will proactively participate in the UNRWA donor conference scheduled to take place in New York on 30 June. Lastly, the humanitarian crisis can only be surmounted if there is a focus on rebuilding. Progress in this direction has been elusive, including rubble clearance, the rebuilding of homes, schools, hospitals, water delivery facilities, sanitation, energy. This access to these facilities remains exceedingly limited, and there are persistent obstacles to the import of equipment and building material. An understanding has been arrived at between the United States and Iran on the parameters of a conclusive truce and normalization of relations, and we fully support this. This should release the necessary resources in order to rekindle the work of the Board of Peace, including in terms of humanitarian assistance. We have yet to see headway being made in that direction, and the International Stabilization Force has not been fully put together, and nor do we see prospects for the full withdrawal of Israeli troops and the launch of rebuilding efforts. The Council, as is reported by media outlets, is grappling with a financing crisis. Roadmap implementation the roadmap of the High Representative Nikolai Mladenov, unfortunately, has encountered a classic fork in the road. What needs to happen first, the withdrawal of occupation troops or the disarmament of Hamas? Without resolving this fundamental contradiction, progress is impossible. We would like to see a prompt handover of the Strip under Palestinian administration. Not only will this be a just solution, but will also help to effectively address pressing issues. At the same time, it is exceedingly important for the new administrative structure through the National Committee on Administration to not to deepen the wedge within the Palestinian ranks and not to worsen fragmentation thereof. There is a need to support humanitarian projects of the Palestinian National Administration through the 18-month plan for early recovery of Gaza, which was developed in Ramallah. This is focused on priorities: hospitals, medicines, temporary accommodation, and basic infrastructure. And this can be done now without awaiting the start of operations of the Board of Peace. To conclude, we wish to emphasize that we trust that the two-state blueprint for resolving the Palestinian-Israeli conflict remains on the table. Alternatives cannot guarantee a lasting peace for all peoples in the region. We highly value the efforts undertaken by mediators through Egypt, Qatar, the Kingdom of Saudi Arabia, the United Arab Emirates. We advocate raising the profile of the League of Arab States on this track. Thank you for your attention.